Hi guys, I just want to do a quick update. I apologize that it has been a while since I've done a video. Um, I think the last update I did was back when I was in the Dominican, so that would have been around the beginning of July. Um, since then, there has been lots that has happened. So basically, we finished holidays and we came back to Beijing. On the 31st of July, I had a pre-surgery consult because the plan was for me to have surgery in the middle of August, and unfortunately that has been delayed, and I will explain why in a moment. But first, the plan as of right now is that surgery will be somewhere between the 17th and the 19th of September. And instead of having the vertical sleeve gastrectomy, they're planning on doing the gastric bypass or Roux-en-Y. Um, so they think because of the amount of weight that I need to lose, the best option for me is gastric bypass. And generally they see somewhere between 85 to 90% of the excess body weight loss within the first and second year of the surgery. So that is some pretty good, excellent results, and I'm very excited about this opportunity, and hopefully we'll be able to proceed as planned this time. So on the 31st, as I said, I went in, I had some blood work done, I had an ultrasound done, I had an x-ray done, and of course the gastroscopy or the endoscopy. So I was quite surprised by what was found because I have absolutely no symptoms. Occasionally I will have heartburn, but that is very occasional. And the only times that I actually do experience heartburn tends to be when I'm pregnant. So, I just chalked it up to that. So what they found was a 10 millimeter ulcer, and is a gastric ulcer that they think has either been caused by a combination of stress as well as using pain medication to cope with my endometriosis. Sometimes the medication that they prescribe tends to wear down the stomach lining, and it can cause a lot of irritation and whatnot. So before my surgery, I would be occasionally taking medication like diclofenac or naproxen, both of which can be hard on the stomach, and they did not prescribe something to coat and protect my stomach while I was taking it, so therefore damage was done. They did do a test to make sure that it wasn't caused because of H. pylori, which would also need an antibiotic treatment, but that was negative. They also found that I have, sorry I'm looking down, I'm just looking at my notes. They also found that I have esophagus reflux, so there's a lot of damage done to my esophagus. They found that I also have bile reflux. There's a lot of bile in my stomach, and that has done some damage, and that could be coming from the fact that I don't have a gallbladder, so there's nowhere really for the bile to go, so it goes back into my stomach. I think that's how they explained it. There is a bit of language barrier here, so it's easier to text them and ask what they mean rather than actually talking face to face. So what they're doing there is they have me on a medication called Nexium, and it's a PPI or proton pump inhibitor. And what it's supposed to do is lower the amount of acid in your stomach, and it should help treat any erosion that has happened to the stomach or in my case, the esophagus, and it should also help heal the ulcer. So the plan right now is for me to go back on the 31st of August or the 1st of September to have a repeat endoscopy done. And as long as that is clear, we're going to be able to proceed with the surgery September 17th, 18th, or 19th. So hopefully, fingers crossed that it's clear. If it's not for some reason, then the doctors will be quite concerned because of the size of the ulcer and all the other damage that has been done. It should heal with all of this medication that I'm on. As I said, I'm on the PPI, but I'm also have been taking medication that stops any bleeding happening in the stomach, as well as a medication that will help reduce the amount of bile that's in my stomach outside of just regular stomach acid. So if there is still evidence that there's an ulcer, as well as any other damage, then they're going to have to take samples to send to pathology, because there could be a risk associated with stomach cancer. So we're hoping and praying for the best. So for my praying friends, you can keep me in your prayers while I wait for this next endoscopy, and hopefully it'll be just clear, plain and simple, that it's just an ulcer and that's it. The other things that they did was a whole bunch of blood work. And if you have been following my Facebook, the other reason I haven't been doing updates is because I've actually been in and out of the hospital. I've been having some swelling with my leg. My right leg is a lot more swollen than my left leg, and they've been trying to figure out why. And some of my blood work was showing me to be at risk of having a blood clot that was either breaking down or forming. So I was admitted for 2 days, and they treated me for a blood clot while they investigated. Thankfully, there was no blood clot, but they still are not completely 100% sure what's going on there. It could be related to my weight, but it could also be lymphedema, I think is what they said. I might be saying that wrong. Because it's not just regular edema, because both legs are not swollen the same. It's asymmetrical edema that's happening. And generally, if it was something that was related to weight, it would be pretty well symmetrical. So some of my blood work is off, and I'm just going to look down on my notes and tell you what it is. So for the levels that are high, we're seeing high levels of uric acid, triglycerides, VLDL. My D-dimer levels, which is the level I was just talking about in regards to blood clotting, was very high. My PT levels were high. My testosterone levels were also high, but that's not overly surprising considering I do have polycystic ovarian syndrome. So you would expect to see a higher level of testosterone for that. My prolactin levels are extremely high for someone who is not pregnant. I think the levels should be like lower than 25 if you're not pregnant, and my levels are over 50. So that's concerning, and that's not actually something I've noticed before in any of the other blood work that I have had done in regards to all of the fertility treatments I have done. So I don't know if that's something that's new. I'm going to have to go back and look through my other levels. However, again, it's not overly concerning because I do have subclinical hypothyroidism, and sometimes those levels can be connected. So I'm not overly concerned as of right now. I am still taking 50 milligrams of thyroxine, but my levels are still at the subclinical level. So they're going to just keep me on the 50 milligrams of thyroxine at the moment, and we'll see what happens as I begin to lose weight after surgery, and see if it's going to normalize on its own or if I need to adjust the medication, because as I have said, I think in past videos, we are hoping to continue our fertility journey after I have gotten to a adequate weight that helps me stay healthy, and so that a pregnancy can thrive as well. I did ask the doctors about this, and they said that we have to wait 1 year, but technically they would like you to wait 2 years if you're having any issues of retaining nutrition or absorbing vitamins and all that kind of stuff. If you have issues, they like you to wait the 2 years so that they can ensure that your body is getting what it needs and that your body can actually sustain a pregnancy and ensure that a baby you're growing is going to be able to get what they need to survive. So those are the high levels, and I'm sorry if I'm rambling. I try not to do that, but there's a lot of information for this video as I haven't filmed for a while. So those are the high levels, and then there have been some lower levels, and those would be my total protein, my albumin, and my HDL levels. And then also I think for high levels, my urine protein levels and my UBG levels have been high. So those sort of correspond with each other as well. So there's something going on that I'm not absorbing protein as properly as I should, and they are still thinking that once I have the surgery, that's going to be changing, as I'm going to be on an extremely high protein, low carb diet, obviously. So we'll see how that goes. They're going to keep an eye on it. I'm going to be going back and forth to the doctor probably every 2 weeks or so. I have access to speak with my doctor on an app in China called WeChat, or we can Skype. So there is access. It's not like they kick you out of the hospital and that's it. They don't leave you on your own kind of thing. So that's good. The other thing I wanted to say is that the plan is that you can go to the hospital if you have a morning scheduled slot for the surgery. You go to the hospital the night before, and then you can have your morning surgery. I live about an hour away from the hospital, so I think they're planning on putting me in the afternoon, and then I can just show up early morning for the surgery. And then they keep you in 5 days and 4 nights. And then once you're able to keep down adequate amounts of liquid, they send you on your way with an appointment probably the following week or 2. So it's good. I love the hospital that I'm using. It's very comfortable. It's the same hospital that I was admitted to last week. And the doctors are good. They actually listen to you. The nurses are good. You know, so, and there's not much of a communication barrier happening, which is helpful. So I'm excited. Hopefully things can proceed the way that we're hoping for, and hopefully that means within a few weeks there's going to be some life changes happening. You know, changes that are going to be happening that is going to affect me for the rest of my life, and it's very exciting because this weight is something I have struggled with my entire life, and I'm excited to no longer have that struggle, and I'm excited to become someone who is healthy again and able to enjoy my life to the fullest. So thank you for watching. Again, I apologize that the video is long and that I have done some rambling. It's probably going to take forever to upload this thing to YouTube. But again, thank you for watching. Subscribe to my channel. Feel free to leave me some comments. If you're on my Facebook, you can also see the actual photos of the labs that I put up. And you can also see the photos of the endoscopy on my Facebook. Okay, so thank you. Bye-bye.